The rotator cuff muscles provide stability for the shoulder joint. Which of the following statements is true about the rotator cuff? Teres major is one of its four constituent muscles. Suprascapular nerve innervates the infraspinatus. Part of its action is to pull the humeral head superiorly. Subscapularis inserts onto the greater tuberosity of the humerus. First, let us study about teres major. Actually, rotator cuff, the musculotendinous cuff, it is formed by blending together of the tendon of subscapularis, supraspinatus, infraspinatus, teres minor around the joint capsule, not the teres major. Subscapularis, supraspinatus, infraspinatus, teres minor. So the first statement, teres major is one of the four constituent muscles, that is wrong. Suprascapular nerve innervates the infraspinatus. So here let us study about supraspinatus, infraspinatus. The nerve supply of both supraspinatus and infraspinatus nothing but suprascapular nerve C5 and C6. Okay, it arises from the upper trunk. So the second statement is right. Let us study about C and D also. Part of its action is to pull the humeral head superiorly. Let us see about the action. Flexion and extension or hypertension occur in sagittal plane around the frontal axis. Abduction and adduction occur in frontal plane around the sagittal axis, that is about around the frontal axis. This is in the frontal plane around the sagittal axis. This is flexion and extension, and that is abduction and adduction, which is far away. Flexion and extension, it is occurring in sagittal plane, and abduction adduction, it is occurring in frontal plane around the sagittal axis. In this is medial and lateral rotation. In none of the statements, humeral head is pulled up superiorly. So statement C is wrong. See here, in these are the actions of all those muscles: delta, supraspinatus, subscapularis, infraspinatus, and teres minor. In none of the actions, the humeral head is pulled up superiorly. It is pulled inferiorly in all those actions. So the statement C is wrong. Fourth statement is subscapularis inserts onto the greater tuberosity of the humerus. See here, supraspinatus and infraspinatus, they are inserted onto the superior facet of greater tubercle of humerus and middle facet of greater tubercle of humerus, and teres minor is also inserted onto the inferior facet of greater tubercle of humerus. And at the intertubercular sulcus, teres major, it is medial lip of intertubercular sulcus of the humerus, teres major. But subscapularis is the only muscle which is inserted onto the lesser tubercle of humerus. So no doubt, if subscapularis is asked, we should think about lesser tubercle, not a greater tubercle. Remaining all muscles, supraspinatus, infraspinatus, teres minor to the greater tubercle, intertubercular sulcus to the teres major to the intertubercular sulcus.